Good morning, everybody, and welcome to the final Lunch and Learn series in our General Practice and Aged Care Incentive webinar. My name is Kayla, and I'm the MyMedicare Support Officer from the Digital Health team here at CESPN. I'm joined today by Amy, who is the MyMedicare Support Officer in the Practice Support team. Today, we're going to be talking about tracking payments and visits for the General Practice and Aged Care Incentive. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognise their continuing connection to land, water, and community, and pay respect to elders past, present, and emerging. I'd also like to extend that respect to any Aboriginal people who may be joining us today. As a part of our ongoing education series, we have several events coming up. CPR workshops are also available monthly across the region. You can find more information via the QR code on the screen. Just a few housekeeping tips before we get started. Please note this webinar will be recorded and will be available on the CESPN YouTube channel within the next couple of days. At the end of the webinar, an evaluation survey will pop up in your web browser. Please complete the survey as we do appreciate your feedback, and it will also allow us to issue your certificates of attendance. Please ensure that you submit any questions in the Q&A function throughout the presentation. To view this box, simply hover over the toolbar at the bottom of your screen. Before we get into talking about the payments and tracking visits, I wanted to give you a quick reminder of the eligibility requirements for the General Practice and Aged Care Incentive. In this example that I have on the screen to show you, I'm taking you through a scenario where you might have a responsible provider and an alternative provider seeing the patient. So the alternative provider can be another GP, prescribed medical practitioner, or nurse practitioner who also works at the same practice as the responsible provider and has been added in the organisation register. The responsible provider is the GP who needs to do all of the care planning items. And as we can see across the top in the purple, there are 4 different options for the care planning items. It might either be a contribution or review to multidisciplinary care plan, comprehensive medical assessment, case conference, or residential medication management review. And within a 12-month period, you will need to pick 2 of these care planning items for your patient. Each quarter, there will also need to be 2 eligible regular services delivered. One of these needs to be delivered by the responsible provider, and the other can be delivered by the alternative provider. If you're the only provider at your practice who is participating in the General Practice and Aged Care Incentive and you would like to do both of the visits by yourself, that's okay too. It's important to remember as well that both of these regular service items must be completed in separate calendar months. To get started, I'm going to talk to you about how to make sure that your patients are registered correctly for the General Practice and Aged Care Incentive. Before going to the step of registering your patients, it's important to make sure that your practice has registered for the General Practice and Aged Care Incentive in the organisation register. If you're not sure about how to do this, please reach out to me. My details will be at the end of the presentation. The first step for any patient in registering for the General Practice and Aged Care Incentive is to register for the overall MyMedicare program. They may do this using MyGov, either using the app on their phone or on their computer, or more likely in the aged care setting, we find patients are registering using the MyMedicare registration form that's here on the screen. When they register using this registration form, you will then have 30 days to input this information into PRODA. However, there is an extra step that needs to be added for those patients who would like to register in the General Practice and Aged Care Incentive Program. In order to do this, you'll need to click on My Programs and My Medicare, which will take you to the patient list. I'm sorry that the pictures are a little bit small and blurry in this presentation. Unfortunately, we're not able to access PRODA to give you a live demonstration in the session. However, these slides will be sent to you after the presentation where you'll be able to zoom in a little bit more clearly. I'm also happy to come to the practice and talk through this with you in person. But as you can see, you will have a list of all of your patients down the bottom of the screen here. What you can do is click on the blue details button in the right-hand corner, and that will take you to the patient's details screen. You'll need to click on the MyMedicare GPACI button from the drop-down menu under the MyMedicare Incentives tab, and then select Add. It will take you to a screen like this, that will allow you to add in some extra details to ensure that you complete this registration. First, you'll need to add an incentive period. You can do that by selecting Add here on the incentive period and adding an incentive start date. It's important to remember that you won't be able to backdate this incentive start date, so it's important to try and add this GPACI indicator as soon as you're ready to start seeing the patient for this program. You don't need to add an end date unless it's applicable to your situation, and then you can click on Confirm. The next step is to add the responsible provider. So as I mentioned earlier, the responsible provider is the person who will need to deliver the care planning services and at least one of the regular services each quarter. They will need to be listed as a provider on the practice's organisation site record in the organisation register and have their banking details added to their individual PRODA account. This is different to a preferred GP when registering for MyMedicare because the patient's able to choose their preferred GP. So this responsible provider for GPACI may or may not be the same as the patient's preferred GP, and both options are okay. So when you click on Add, there'll be a drop-down menu where you can click on the provider number that matches the responsible provider. It's important to remember that the provider number will only be available as an option if you've added them to the organisation register and added their banking details to PRODA. After that, you can select Confirm and then click on the tick box and select Save. It's really important when you're doing anything in HPOS or PRODA that you select save as often as possible. I often find that I might accidentally go in and do something, and if I forget to click save, then when I go back in, the information isn't there anymore. So I would always make sure that I click save and then go back out to the overall My Medicare screen and then click back in on this patient's detail just to make sure that the GPACI indicator has definitely been added. Because as I mentioned earlier, if the GPACI indicator has not been added for every single patient that you would like to enroll in the program, then the visits that you're doing won't be able to count for the patient and they won't be able to be backdated. So it's really important to set this up correctly from the beginning and make sure that it's accurate so that you know that all of your patients will be able to be eligible in the future. You may find that you need to amend the incentive period and add an end date. So this may happen if patients are no longer eligible for GPACI services, for example, if they're in respite care or if they've moved out of residential aged care, or if you've added the incorrect date in there when you put in the start date. So you can click on Amend and then add an end date and select Confirm. If the patient does pass away, then it's important that you add the withdrawal date. Sometimes this may happen automatically, other times it may not. So it's important to go in and check if you need to do this for a patient who passes away. It's important to remember that you should never delete the patient out of MyMedicare because this can change the payment that you might receive either in the future or that it can go back and change payments in the past. And you don't want to delete any of the work that you've done with the patient before. So always go in and just add that withdrawal date and select Confirm to withdraw them rather than deleting them from MyMedicare. Now we're going to talk about how you can check if you are receiving the payments correctly each quarter. Whenever we're talking about payments for the GPACI program, it's important to remember that you'll be getting a payment for the practice and a payment for the GP every quarter. What this means is that there's two separate places where you can look into to try and find information about the payments. If you'd like information about the payments for the practice, you can log into PRODA on behalf of the organisation. And as you can see in the top right-hand corner of the screen here, it's very small, but it says acting on behalf of, and then the organisation name. So whenever you're acting on behalf of the organisation, you'll be able to access information about all of the GPs who are providing GPACI services at the practice. If you're an individual provider and you would like to find out more about the payment that you're receiving individually, the steps will be exactly the same as what we're going through on the screen here, except instead of logging in on behalf of the organization, you'll need to log in your individual PRODA account and then follow the same steps that way. So again, once we've logged in, we'll click on My Programs and My Medicare, which will take us to this screen here. And this time we're going to select Search Payment History. We'll be able to select the organization site from the drop-down menu here and pick the organization site ID that matches the one you'd like to look at. And then in the incentive type, you can also click on the general practice and aged care incentive and select search. It will take you to a screen like this one that has a lot of information about the payments. As you can see here, there's a payment ID and the incentive type. It will also tell you the assessment period, so the quarter that it was assessing. In the payment type, here we've got all examples of where it's a regular payment, but this may also say something different if it's a manual payment to correct an error that's been made in the past. This payment status here will let you know if it's been paid into your bank account or if potentially there's been an error with the bank details. It might say that it's been cancelled. And then it also has the sent date and the amount. So if you're seeing a lot of patients for the general practice and aged care incentive, this amount might be quite high. And so it's important to go into it to just try and break it down and see where this number is coming from. You can do that by clicking on, actually, if we go back to this one, you'll just click on View Details here in the blue, which will take you to this page. And that will allow you to get a little bit more information. So you'll be able to see the bank account details that you've put into HPOS to make sure that those are correct. And you'll also be able to see which patients have received a payment. So which patients were eligible for a payment. If you want to break it down even further, you can click on Action up here in the top right-hand corner and then click on View Assessment Details. And that will allow you to have a look in a little bit more detail about which patients were eligible for a payment and which were not. And you can see here for this organization, it says that 2 out of 2 of their providers met incentive requirements. That just means that 2 of their providers had at least one patient who met the incentive requirements. You can also see here that they're indicating 8 out of 16 patients met the incentive requirements, which means that this practice would have received a payment on behalf of 8 patients, and then the further 8 patients would not have received a payment. Down here under organization site requirements, this just gives you a bit of an indication if the practice has registered for this incentive correctly and if they're also registered for MyMedicare. It's important to check that this is green because what might happen is if your practice goes through accreditation and then you don't update your accreditation information in the organization register, it might indicate that you're no longer registered for MyMedicare as you need to be accredited to access MyMedicare. So it's important just to check that this is always green so that you know your practice is registered correctly. We'll have a look now and see what will happen if we click into the responsible providers. So you can see there's 2 different example doctors here. And for each doctor, you can see how many patients they had that counted for the payment and how many patients had not counted for the payment. So you may look at this and feel like this makes sense and you're happy to leave it here, but other times you might want to look into a little bit more detail just to see who these patients are and why they haven't been counted for the payment. So if you click on View Patients here, it will take you to a screen that looks like this, and you'll be able to see for each individual patient what actually happened and why they were not eligible for the payment. As you can see, the assessment type here is indicating that it's quarterly for both of these patients. That just means that they're in their first, second, or third quarter. And in order to be eligible for the payment, they were just looking at the quarterly servicing requirements, which was just those 2 regular visits in separate calendar months. If this said annual, then it would be taking into account the annual requirements too. And that happens in the 4th quarter for each patient. So that's when they're also taking into account the 8 visits within the calendar year, within the 12-month period for the patient, and then also the 2 care planning items as well. So as you can see for this patient here, it's indicating that they have 1 eligible service item. And the reason that they didn't get a payment is because the minimum required regular services are not met. And that makes sense because we know that they need 2 regular services items in order to get the payment, and they've only had 1, so they didn't receive the payment. For this patient down here, you can see they've had 0 visits that have met the requirements. And there's an extra indicator here that says minimum required regular care services are not delivered by responsible providers. And what that means as well is that not only were the minimum required regular services not met, but one of them was not delivered by the responsible provider. Now, as we spoke about earlier at the beginning of the presentation, at least one needs to be done by that responsible provider that we linked in HPOS, and then the other one can be done by another provider at the practice. If we want even more information, we can click on View Details. So if we see a patient and we think, oh, I'm pretty sure I saw them more than once or more than 0 times, let me just check and see why this has happened. We can click on View Details here. And it will take us to a page that looks like this. for each patient. So you can see the patient name is up the top here. And in this example, this patient's actually looking at the quarterly and the annual requirements, which means they must be in quarter 4. And you can see that again here, it says Q4. In this example, the patient is eligible. However, if we clicked on a patient who was not eligible, it would say not eligible up here. But it breaks it down into the more specific details about the patient. So we can check that yes, they definitely were registered for MyMedicare, and we linked that responsible provider in the GPACI incentive. If we look at the quarterly care here, we can see that they've had 2 eligible services that were delivered by the responsible provider, and then it's just counting it again as those regular services delivered. So that just might look a little bit different if one of them was done by an alternative provider, but we can see that they're both eligible. And then when we're looking at their annual requirements, they've also met those because they've done the 8 visits over the whole 12-month period, and they've done 2 care planning services. If you wanted to look and see what services actually were making up these numbers here, you can click on service details, which is just the next tab. And that takes us to this page here. So you can actually see which item numbers were billed, and you can see the date that they were billed and if they were eligible or not. So it's important to just check in here if you're not sure about why a payment may or may not have been counted, because that will help you to make a decision if you can see which item numbers are available here and you know that you visited them another time and it's not popping up here. It's important to investigate that to see, is it because the MBS billing didn't go through? Were you using the correct provider number? So there's some troubleshooting steps that you can take, and I'll talk about that in a moment. The last tab across here is just on the right. It just says responsible providers, and that's just another way of double checking who is linked as the responsible provider for this patient. And just making sure that they're eligible too. So the way that they become eligible is by adding them in the organization register, and adding their banking details on PRODA. So if you do get to the end of a quarter and you realize that there's been an error with your banking, with your payment, there's a couple of different things that you can have a look at. The first step is to make sure that you've added your banking details. That's both for the provider and for the organization. If that doesn't happen, then the payment won't go through. It's also important to check if all GPACI participants, so that's the organization, the responsible provider, and the patient, were all assessed as eligible for the incentive period. And we saw the different places that you can have a look for that in HPOS. Next, it's important to check if the correct number and type of services were provided during the incentive period. So you'll be able to see which item numbers were billed and make sure that those are the ones that are on the list of acceptable item numbers for the GPACI incentive. This is a really important one here. You can check, does the Medicare provider number used for the claim match the one that's linked to the practice? So in the situation where a GP might have multiple provider numbers, it's important to make sure that they're only billing the services for their GPACI patients with the Medicare provider number that's attached to the organization register on PRODA, because that's the way that they're tracking if the visits have been completed. So if you accidentally bill the patient with a different provider number that's not linked to the organization, it won't be able to recognize that that's a part of the GPACI program. So you should always use the one provider number. And then lastly, were all the MBS or DVA items claimed before the period was assessed for payment? So you may have done the visit towards the end of the quarter, but the item numbers hadn't gone through before the end of the quarter. If that does happen, that's okay. It is actually able to be backdated. So anytime that you notice there's been an error with that, you can always just submit the claims, and then next payment that goes through, there'll be a correction applied for that if it meets the requirements. If you've been through all of those steps and you still can't figure out why the payment doesn't match up with what you're expecting, or you think there's been an error that's happened, you can ask for a review of decision. So I've included the link here that you can click on to access the form, and you're able to submit that to Services Australia and just provide some documentation. Then they can try and investigate that further for you. It's really, really important that you're always accessing correspondence through the messages in HPOS. Each time that a payment goes out, there'll be some sort of correspondence, whether that's to let you know that the payment's gone through or that it hasn't gone through, potentially if something needed to be reassessed. Also, if there's any eligibility issues. So if you have not provided the care planning services within the 12-month period, then you might get a letter to let you know that you need to do one for that patient in the next quarter. Otherwise, the patient will no longer be eligible. So there's some really important messages that come through HPOS that are quite time bound. So I would be checking this as often, maybe even once a week or so, just to try and make sure that you're up to date with all of those messages. Now, I'm going to talk to you about how you can forecast the eligibility, because it's all well and good to be able to check about things that have happened in the past, but as we know, we can't always go back and change them. So it's really important to be proactive about checking your eligibility so that you have enough time to make those changes, before the payments actually go through. So it's the same as the situation with the payment. So you can either do this on behalf of the organization or just on the behalf of the individual GP. But in this example, again, I'll be doing it on behalf of the organization. So similar to before, you click on My Programs and My Medicare again. But this time we're going to click on View Payment Eligibility. And it will take us to a page like this that allows us to forecast an assessment. So a forecast is sort of a snapshot at a particular point in time of what's happening for those patients and the eligibility for the payments. What I'd like to do is every day that you want to log in and look at this, I would run a new eligibility forecast because you want to make sure that you're getting a snapshot of the most up-to-date and correct information. So you do that by clicking on the forecast assessment, selecting your organization site, and then forecast. There's usually a message that will pop up that lets you know that it might take up to an hour to complete the forecast. But in my experience, usually if you just click out of this back into the main My Medicare section and then come back in, it's usually been enough time and it's already ready. When you come back in, you'll just want to click on Search Assessments and you'll be able to see all of the assessments that you've ever forecasted and just select the one that corresponds to the date that you created the forecast. So it will take you to a page that actually quite looks quite similar to what we were talking about before with the payments. It's just the difference is now the same information is allowing us to make adjustments and make changes before we get the payment. So all of this is still the same on the front here. You can check if everybody's eligible and registered. And you can have a look at the responsible providers as well and see how many patients have been counted or not counted for payment. Remembering that if you're looking at this at the beginning of the quarter, you'll probably have all of your patients not being counted for payment, because you need to have those two visits in separate calendar months. So don't panic if it's the beginning of the quarter and you notice that everybody's not counting. It'll take a bit of time to do those visits and start moving them over to this column here. But if you click on View Patients, it will take you to this screen where again you can see the eligible and the not eligible patients. If you click on not eligible patients, it will tell you why they're not eligible. So you'll have a bit of time to figure out how many visits is counting so far in the quarter and what do I need to do to make up to the 2 visits so that I can get the payment by the end of the quarter. If you want to look in a little bit more detail to a particular patient, again, you just click on View Details here and you'll be able to see it broken down in a bit more detail. So we can see again the quarterly care items, the annual care items. In this example, the patient has been seen 14 times throughout the course of the year. So obviously that's a bit more than what's needed for the incentive, but this patient may have needed some extra care. So it's still registering all of the visits, but you only need that 8 to meet the requirement. You can then click on service details to figure out which services are actually counting towards this incentive. And you can see in this example here, the patient was visited in January and February. So those were separate calendar months. Those are both counted as eligible. And then once they were visited in March, now it's saying that they're not assessed. And that's because the eligibility rule has already been met. So they've already met the requirements. Any extra ones you do on top of that will still show up here, but they just will be counted as not assessed. Something else that you might see in this situation is if you visit the patient 2 times within the same month, again, it will say that it's not assessed. So it's important to make sure that those 2 visits are in separate calendar months. And then lastly, as a bit of a check, you can always just check that the responsible provider is eligible. So This information is really important because it gives you a chance to go in and check and just make sure that things are on track and do those adjustments as needed to ensure that you're providing the services you need to provide for your patients. I would be checking in with this at least once a month because, as we know, if we only check in at the end of the quarter, and there's patients who we haven't visited yet, it'll be too late to make up those eligibility requirements because those visits need to be in separate calendar months. So checking in each month allows you to have the time that you need to make those adjustments. I wanted to show you some ways that are available to help you keep track of all of this information. Um, this is a spreadsheet that has been released by the Department of Health, Disability and Aging. I'll be sending it out to you with the session slides today. I put a bit of a screenshot in here. Usually it's a bit bigger. There's the patient information off to the left-hand side, but I just wanted to show you that it gives you a way of being able to keep track of which care planning services you've done, and also which regular services you've done for each quarter. So as you can see here, when I've selected yes for 2 out of the 4 options for the care planning items, now this flag has gone green to let me know that the patient will be eligible. In this example here, I've said that the second eligible visit's been completed, and again, the flag has gone green. But as an example here in this first one, I've only done the first visit, and so the flag is yellow to let me know that I've done part of the requirements, but I haven't met them all fully yet. So this is one way that you might like to keep track of patients, especially if you don't have too many patients, then this can be a feasible way of doing it. But I know that if you have a lot of patients at your practice who are in aged care, it can be really tricky to keep track of all of it manually, and it can take a bit of time. So I'm really excited to show you a new tool that will be available in Polar on the 17th of September, and that's called Puffin. So all of the different tools in Polar are named after Arctic animals. But this one is a dashboard and tool that enables practices to track their regular visits and care planning items. So you'll be able to flag all of your patients who are registered for the general practice and aged care incentive. And then it will be really, really easy just to quickly go into Polar and there'll be a report that's already created for you. And it will show you what needs to be done each quarter in order to meet the eligibility requirements. So I think this will be very, very helpful for practices to be able to track this automatically and should hopefully save a lot of time and make things a bit easier. Outcome Health, who created Polar, will host an online training session at 12 o'clock on the 17th of September. So I'll also be including a link to sign up for this in the slides for today. I also just wanted to draw your attention to some resources that are available on Service Australia's website. They actually have a lot of resources there for MyMedicare and the General Practice and Aged Care Incentive. They have some infographics that are quite broken down into specific steps and are very simple and easy to follow. But they also do have some simulations where you can click through and go through the steps, either for registering patients or for checking the payments or the eligibility. So there's a lot of really good information there. If you'd like to have a bit of a refresher after today, then I'd really recommend having a look on there and seeing if you can find some information about what you need. And lastly, I know that there's a lot of information out there about the general practice and aged care incentive, and it might be helpful to have somebody there with you going through and having a look at this process for some of your particular patients. So myself and Amy are more than happy to come to your practice at any time. To go through these steps with you and just help make it a little bit more personalized or help you come up with a system that works for you for tracking your patients. So we have our mobile numbers and our email addresses up there on the screen. Please feel free to reach out to us at any time if you need any help. I'll stop sharing there. Amy, did we have any questions come through in the chat?
Thank you, Kayla. We haven't got any as of yet, but if anyone does have any questions, feel free to pop them in the chat and we can see if we can answer them for you.
Hmm.
However, prior to this, we did come up with a few frequently asked questions that we have received in the past. So, Kayla, I might just ask you, and yeah, please, if you do have another question, pop it in the chat and we can answer it as well. Um,
Perfect.
okay, so what happens if I don't do the care planning items in 12 months?
Yep. So this is a scenario that's popped up a bit recently, as we've just gotten to the end of the first 12-month period for those patients who signed up as soon as the incentive started. So if the two care planning items have not been done within the 12-month period, it means that you need to do at least one care planning service in the first quarter of the next year for the patient. Otherwise, they will no longer be eligible for the GPACI program. So it's really, really important. If this is your situation, you'll receive a letter on HPOS in the messages section, and it will outline which patients this applies to. So it'll be really important if you do get a message like that in the future to have a look through, see which patients need those care planning items, and then do at least one of those care planning items within the next quarter to maintain that eligibility for those patients.
Okay, great. Thank you, Kayla. Another question that we've had come up is how does Service Australia get the information about which services I have delivered to patients?
Yeah, so the assessments will be based on the submitted Medicare or DVA claims. So there's no other paperwork or anything that needs to be submitted to have those payments calculated. It's just important to make sure that you're putting those claims through with the correct provider number to make sure that it's linked to the practice.
Okay, thank you. Um, okay, another question we've had is what do I do if I get a HPOS notification saying update your MyMedicare banking details, payment failed for the period?
So that answer depends on whether you're a provider or the organization who got this notification in HPOS. But providers need to update their My Medicare Incentive Program banking details in HPOS, and that's on their personal PRODA account under My Personal Details. And then for the practice, they need to update theirs in the organization register under program registration.
Okay, great. Thanks, Kayla. Another one about the puffin. So what can I do if I want to use puffin, but I don't have Polar?
Yeah, so if you don't currently have Polar installed, then please reach out to the digital health team at the PHN. You can either reach out to your digital health officer or to myself, and we'll be able to organize installing that for you. The PHN will fully subsidize the cost of the license for Polar. So if you don't currently have it, I really would recommend reaching out because I think this Puffin tool will be really helpful for tracking your visits over time.
Okay, thank you, Kayla. And then one of our last questions that we've had is, what happens to my payments if I move practices within a 12-month period?
That one's a bit of a tricky one. So, anytime that a responsible provider moves practice, it means that the 12-month care period will reset. So, if you have a doctor at your practice who's been seeing a patient and they then move to a different practice, you'll need to reassign that patient to a different doctor at your practice, but it will start again from the beginning for their 12-month care period. That's the same if the patient chooses to register with MyMedicare with a different practice. So they're able to do that at any time. And what will happen is when they sign up with their new provider at the new practice, it will just reset that 12-month care period again for the new doctor.
Okay, thank you, Kayla. Oh, we've just had one come in, which is good. So from Mandy, so can Medicare reject the items for GPACI for any reason?
Oh, that's a good question. I think there can be reasons why MBS items are rejected, but there's no particular rule, like I know with CCM, how a patient has to be registered for MyMedicare. Otherwise, or sorry, if the patient's registered for MyMedicare at your practice, then it will go through. If they're registered at a different practice, it won't go through. There's nothing like that with GPACI. It will just sort of apply with the usual MBS billing requirements.
Okay. And then we've had someone comment, great webinar, very informative. So that's oh, that's
Oh,
always
thank
good.
you. That's very nice.
Yeah. Is there any other questions? If you've got anything burning, please do put them in the Q&A. But as Kayla mentioned, we are more than happy to come out and go through it with you in more detail, more specific to you and your practice and your patients. So please do let us know.
Yeah, there's definitely been a lot of information that practices have had to learn about the general practice and aged care incentive. And so I think it's just a learning process, and it's one of those things that the more times that you do it, the more that it will start to make sense, and you can get a bit of a system together. But it's only been a year that this program's been out, so there's still a lot of things to learn and to improve on.
Okay.
Perfect. Well, thank you so
Yeah.
much for attending the webinar today. Please remember to fill out the evaluation form at the end of the presentation. And I can just see one last question. Can you please email us the PowerPoint? Yes, we will email the PowerPoint alongside the links that I've mentioned today in the presentation and the FAQs. Perfect. Thank you so much. Have a good day, everybody. Bye.
Bye.